A cigarette contains about more than 4,000 toxins. A cigarette is risk factor for about two dozens of the cancers and dozens of the chronic diseases. But here I would like to discuss the effect of smoking on wound healing and other per-operative and post-operative problems. The cigarette affects about all phases of the wound healing. So quitting cigarette even one day before the surgery can positively affect the wound healing, and even in a non-smoker, taking cigarette one day before the surgery can affect negatively the wound healing. Cigarette smoking affects wound healing by different mechanisms. Mostly three factors are responsible for delayed wound healing in cigarette smokers: the nicotine, carbon monoxide, and hydrogen cyanide. Nicotine causes vasoconstriction, so decreased blood flow to the affected area or injured area, so the wound healing process is delayed. Secondly, it also causes the aggregation of the platelets. It increases the adhesiveness of the platelets, so it forms the microclots and affects the microvasculature, and by this means it decreases the supply of the nutrients and oxygen to the wound. Secondly, carbon monoxide. The cigarette contains carbon monoxide, and that is inhaled, and carbon monoxide has affinity to bind the hemoglobin about 200 times more than oxygen. So the carrying and delivery of the oxygen is disturbed to the target area, to the wound, to the injured area. So by tissue hypoxia, the wound healing is affected. And thirdly, the hydrogen cyanide, which affect the oxidative process, metabolism at cellular level. So these three factors causes delayed wound healing. Apart from that, the cigarette decreases the function of the neutrophils, macrophages, the fibroblast, and the natural killer cells. So these all affect the wound healing. So by affecting these immune cells, they affect the especially the proliferative phase, the angiogenesis, and the scar formation and maturation of the scar. By decreasing the function of the fibroblast, and collagen synthesis is decreased. It also inhibits the conversion of the collagen 3 or 4 to 1, I think. So that is very important for the maturation phase, and that is the stronger collagen type 1. So that affect the collagen also. So for every patient who's going to be operated, ideally the cigarette smoking should be quit 4 to 8 hours, 4 to 8 weeks before the surgery, or even as I had told that even one day before surgery, if you quit the cigarette smoking, it would be beneficial for your wound healing. Apart from that, the cigarette smoking can increase the risk of cardiovascular events, strokes, pulmonary embolism, DVT, and other problems also. So cigarette smoking for the surgery patients is very critical.